Rachel Castaneda, and I'm a professor of psychology at Azusa Pacific University in the psychology department. I help lead the university's drug and alcohol counseling certificate program that's certified by the state of California. It's called the Consortium of Addiction Programs and Professionals. I'm also an associate research psychologist at the University of California, Los Angeles, UCLA, in the integrated substance use and addiction programs. I work alongside several faculty and other research associates in what we call the PRAY Lab. It stands for Promoting Resiliency Among Youth. We implement in the PRAY Lab multiple projects that are federally funded, state funded, locally funded to address substance use risk, mental health, comorbidity among youth and families in the local community. Some examples of projects that our PRAY Lab and our team work on currently include building California's Service to Science Academy and the state's evidence-based resource registry that's focused on substance use and mental health prevention. Work with APU and UCLA colleagues on that. And other initiatives that we have in the lab have to do with some SAMHSA grants at the federal level. SAMHSA stands for Substance Abuse Mental Health Service Administration, and these grants help us and our team address ongoing needs of youth in the community. So youth are the adolescents, the transitional age youth, so 12 to 25, and we promote program development. We work with community partners in the local community of Azusa or San Gabriel Valley, Duarte, Monrovia, Almonte, that all have high rates of substance use, mental health, overdose, justice involvement, high dropout of school or not continuing to go to higher education, housing instability. And so we work with the partners to develop curriculum, to develop early intervention programming, parent resource and support information to help equip caregivers and family systems to also partner to address the ongoing needs of the youth. We also work with LA County and the state, the state's California School-Based Mental Health and LA County Department of Public Health, Department of Mental Health, the LAHSA, which is the Los Angeles Housing Authority, as well as DCSF providers to train them, to do workforce development and train them on evidence-based practices to address, to better equip them on how to come alongside youth and families with culturally responsive, trauma-informed care that will help in terms of the area of prevention, early intervention, treatment, and recovery support. So our team supports various training initiatives. We are a provider of continuing education to build the competencies of providers across low-level workforce, so certified drug and alcohol counselors, peer support specialists, as well as licensed providers, the LPHAs, the licensed providers of the healing of the arts, so doctors, psychiatrists, psychologists, clinical social workers, school-based psychologists, teachers, counselors, marriage and family therapists, right? So we equip and train all of the provider kind of behavioral health network to address the co-occurring needs of youth. And that's why we are proposing Project MAP-C to your agents, to your organization. We're really thrilled for the opportunity. MAP-C stands for Mental Health Awareness and Prevention in the Community. This initiative is designed to expand access to mental health and substance use prevention by equipping the local community partners with tools and training and resources needed to support youth, specifically caregivers as well, where meeting youth where they're at. The funding will support building stronger, more resilient communities and creating pathways for youth to achieve long-term health and well-being.